Good morning, everyone. Thank you for joining us this lovely morning for a COVID-19 community webinar. I'm Joey. I'm from HealthMetrics. I'll be hosting today's webinar. And it's our privilege and honor to have Dr. Ernest today to speak about COVID-19 vaccination. A brief introduction on Dr. Ernest. He's a consultant respiratory physician in UMMC and UMSC. He's currently an associate professor in Faculty of Medicine in UC Malaya. During this time, he's also co-managed COVID positive patients in UMNC. He treats various diseases regarding to the respiratory and sleep condition, and he has an interest in lung cancer and also COPD. Without much further ado, we're just going to start the webinar. There are a lot of questions we have received the past over a week ago, up till yesterday. So we want to utilize this time to ask as many questions as possible to Dr. Ernest. What's your view on thalassemia beta carrier? Is it not recommended to take the vaccine or just avoid AstraZeneca vaccine with a smiley face?
Thalassemia beta carrier. So thalassemia is a condition where you carry a gene that can potentially cause your red blood cells to be destroyed by the body at a faster rate than a usual person. So these patients can sometimes be anemic or have a very mild anemia, which means low hemoglobin levels. Generally, they do not have any problems with clotting or bleeding and stuff like that. So there is currently no evidence to say, and it's not a contradiction to not take the vaccine at all. You can still take the vaccines even though you are thalassemic. Okay.
And then we'll go on to the next question from the audience. Will mRNA change our gene? Is there any facts or studies to prove that?
Well, no. At the moment, if you're talking about the the Pfizer vaccines or the Moderna and also the inactivated vaccines, they do not enter into the cell nucleus at all. The viral vector cells, the viral vector vaccines that do carry the DNA into the cell, actually the virus are unable to replicate itself, and the DNA is only used to produce the mRNA once for the COVID spike protein to develop. So actually it does not alter your DNA or your genes at all.
Oh, I hope now everyone has more factual. I think there was just a lot of news online, right? And I hope that answers your questions, whoever that posted it. There's another question from the audience. If a vaccinated person is infected, can the vaccinated person infect others?
Yes, potentially. So there are still a lot of studies being done on transmission. So the vaccines protect you against the serious side effects, as we mentioned earlier, but there is still not enough data to know whether they protect against transmission. So you could still be carrying the virus, you do not feel anything or you don't feel any serious side effects, but you can still potentially pass the virus on to someone.
Okay.
So the transmission is still something of a big question. Of course, researchers and experts believe that there are some reductions of transmission because generally you will be more asymptomatic, means you will not have any symptoms after contracting COVID. And of course, asymptomatic patients generally don't transmit the virus so much compared to someone with symptoms. So if you're having symptoms like a viral, like a runny nose, a cough, or whatever it is, you tend to transmit the virus much more than someone who has no symptoms at all.
And that's why it's so important to follow the SOP, like just wearing your mask itself.
Because you're actually protecting your loved ones. Because even though you have got the vaccine, you don't know whether you are still potentially able to transmit the virus on.
Yeah, does that mean I have to wear a mask when I'm at home too?
Unless we achieve herd immunity, something like what Israel is doing. You know, they have vaccinated almost 80% of their population right now, and they are going out without masks.
Oh, okay. We hope that will be possible one day with Malaysia. So guys, wear your mask. It's very important. So I think just to summarize what Dr. Paul was saying, essentially having COVID-19 vaccine is important just so that you can reduce your symptoms. You can reduce the severity of being hospitalized. It helps with our healthcare system. It does not mean that you will not get it again. I think people generally had this perception, oh, if I'm vaccinated, I'm free to go party, but really that's not the case. Am I right, Dr. Paul?
Yeah, unless we achieve herd immunity.
Yes, we're there, I guess. We're working hard on it. Yes,
Yeah,
on
the
the
issue is the
meantime,
supply, of course. I mean, it's slowly trickling in. I mean, vaccines are slowly trickling in, but yeah, the supply is a little bit slow at the moment. Yeah.
yeah, and that's not in our hands. And the best we can do right now is really to follow the SOP. There was a question from the audience. Earlier, you talk about the difference between mRNA and adenovirus and inactivated virus. And the question from the audience was, is inactivated virus vaccine the safest?
Okay. So the golden question. A lot of people believe that because the technology is the oldest, so there's so much data available on this sort of vaccines. But with each type of vaccine, actually the every vaccine is unique by itself, and that when the researchers create a vaccine, they would still need to test it out in phase 1, 2, 3 clinical trials before we can say that it is the safest or anything. But so far, you can't really say that the inactivated vaccine for COVID-19 is the safest so far, because as I pointed out earlier, there are some lacking data in terms of comorbidities, and China vaccines have been a little bit slow towards publishing in peer-reviewed international journals. There are some data, but they are not as comprehensive as the US and the European data. So to generalize and say that one vaccine is more safe than the other at the moment is still, I mean, there is no truth in that, because what we can see is, sometimes you may not know certain things about certain vaccines just because it's not published, it's not reported. So there is still a lot of, I mean, of course, there are concerns, but one thing to note is that these very, very serious side effects are very, very rare. And I think one thing that I needed to bring up is that you need to have a calculated risk. How at risk of you of getting a COVID-19, and if you do contract COVID-19, what is going to be the outcome? If you have a lot of issues with your health, or you are in an age group where you are very vulnerable and that getting COVID-19 means the end of you, then there should be no hesitancy towards getting a vaccine. And there is no one vaccine that is safer than the other at the moment, because these rare side effects are very, very rare, and you need to calculate the risk and the age group that you're in to weigh the benefit versus the risk of getting the vaccine itself.
Thank you, doctor. I think, like, just to summarize, yeah, it's really important to calculate your risk, and that's the reason why we have this webinar, so that it's really essentially to educate the community, like what are the factuals, information there, because there's just so many things that we can Google these days, right? And one of the questions from the audience was, the person is a recovered patient from COVID-19. Is it advisable for them to take the vaccine? I believe doctor have answered this earlier. It is advisable for you to take your vaccine after 14 days.
At least after 14 days. But some guidelines recommend even up to 90 days after that. So it really depends. If you're at a high risk group of getting COVID itself, and then why not get it after? I mean, if you have access to it, then why not get it after the acute infection has settled?
Thank you, doctor. And another question from Karen was that she came in contact with someone who was positive. How soon should she get tested? Because I think a lot of people do not know what are the incubation, and it's still in the air, right? Like, oh, do I get tested the moment I know my friend is positive, or do I have to wait a few days for it?
Yeah. So I initially wanted to do a video on this last year, but then I was just too busy with work. So anyway, when you do come into contact with someone who is, so it really depends. So but the ministry has come out with clear guidelines as well, whether the person that you come into contact with is a positive himself when you met him or her, or it is just, another friend, he or she met another friend who was positive and he's getting tested. So it depends on how far the link is. But let's just take, for example, you met someone who didn't know he was positive and then later on became positive. Okay, so that means he is having the COVID virus, but he didn't know. Okay, and then later, about 2 days later, maybe he had some symptoms, and then he went to check, and then he found out that he's tested positive, and then he told you that, oh, I'm positive and I had a meal with you 2 days ago. So by right, we recommend getting tested if that person is positive and there was a period of time where you met him without, both of you were not wearing a mask. Again, you have to calculate the risk. It is recommended to get tested immediately because the virus takes about it can take anywhere from 1 to 5 days to incubate, and then it could manifest itself. So you can get one done, but that does not mean you can go around running around because you already had a positive contact. It means that you should stay at home as much as possible, quarantine yourself for a little bit, and then get it tested again after 5 days. That's the general recommendation at the moment, if you do not have any symptoms. After 5 days, if your result is negative, it's very highly unlikely that you actually contracted the virus.
That's very good answer. I think, Karen, as what Dr. Po said, if you have no symptoms after day 5 and you got tested, it's negative, then it's pretty confident it's negative. This is a very good question from the audience. Can they still donate blood after being vaccinated? And as we know, we are a lack of blood in our blood bank. Yeah.
Yes. There is no, this is such a niche group and such a niche need at the moment that there is no data or no contradiction to get donating blood after getting the vaccine.
Okay. So yeah, whoever answered that questions, you feel free to donate your blood after being vaccinated. Another question is, do you recommend our parents to bring along their medication to the doctor for assessment during the vaccination appointment?
They can bring a list if they want to. They can bring a list, but generally, I think if you are not on any, like for example, blood thinners, or if you are not a cancer patient that are on some immunosuppressants or rheumatological disorders, then I think these medicines have to be made aware to them. But if let's say you are on just a general medicine, like for example, for hypertension, high blood pressure or diabetes, then you don't need to bring all these medications to the doctors unless you have a specific condition. For example, you're on a blood thinner, or you are a cancer patient on certain forms of chemo or immunotherapy, or any drugs or targeted therapies, or if you are if you have some rheumatological or some other conditions that causes you to need to take immunosuppressants, then I guess these are a medication list should be given to the doctor so that they are aware that you are this sort of patients. Again, they will probably monitor you a little bit longer after the jab, maybe 30 minutes, but generally it is not a contraindication to getting vaccinated.
Okay. Thank you for answering the question, doctor. So yeah, you can bring a list of, whatever your parents are taking, just to the attending doctor during the vaccination day. Unless you're on blood thinners or a cancer patient, then you might need to be monitored longer. Am I right, doctor?
You will need, if you have certain health conditions that you are taking drugs that are not like common, like not in the general population, like hypertension or diabetes. So that means more drugs that are potentially can affect your immune system or blood thinners, then you should just bring a list along so that they are made aware that you have this. And of course, for example, if you're on blood thinners, then they would need to compress a little longer on that side for at least 2 minutes after they have given you the injections.
Okay, thank you, Dr. Po. And I think now a lot of people have signed up for the vaccination voluntary, and one of the questions from the audience was, is there any preparation required before taking the vaccine, such as food to avoid? Do you have any general advice for people before they go for their vaccine?
There are no dietary restrictions or anything to be watchful for. I think some patients would generally just feel a little bit more anxious on the day of the vaccine because they're getting something foreign jabbed into them. And of course, I guess what I just tell my patients usually is just go with a light meal. Don't take too much food. Otherwise, you may because of all the anxiety and all the hype, you may feel very anxious. You may feel like you want to throw up, and this is something that you don't want happen on the day of the vaccination itself. So do eat, of course. You don't want to faint as well if you are like low on sugar, but take a light meal before you go for your vaccine.
Yeah, thank you, doctor. And this is a question from Logesh. We know so little about the efficacy of Sinovac with varying efficacy in various countries. Do you have any updates of this or any side effects of Sinovac?
No. So my updates is exactly the same as whoever asked that question earlier. It is all from the reported, I mean, all the press releases or the from the company itself, all the reported clinical efficacy from their phase 3 trials. There are a huge, of course, a variation between the efficacy of the Sinovac vaccine itself. But as I said correctly earlier, anything that has been approved by the FDA or but the Sinovac is not the FDA, obviously it's the China, but by the national regulatory authorities, then as long as they do offer a certain amount of protection, then that would contribute towards achieving herd immunity in the country. As I said, that efficacy shouldn't be the number one concern on. Obviously, if it is more than 50%, and most of the time they would already been approved because you're already reducing the risk of contracting a severe COVID infection by half. So this is not a competition of getting a better vaccine over the other. It's just trying to see how much people we can vaccinate to protect those that we can't.
Right. Yep. And the next question was, there's reports stating that Pfizer vaccine has caused neurodegenerative disease. Is there any truth to that?
So they are still investigating. As I said, whenever all these adverse events gets reported, all the authorities will have to look into it to see whether there is a causal relationship or just a correlation. But so far, none of this has been given a red signal by the US FDA authorities.
Okay.
So there are some case reports here and there, whether it's actually, I mean, even during the clinical trials, you know, whenever a volunteer that goes for a clinical trial and there's a death encountered and the cause of death may be reported as such and such, the investigators will have to look and see whether that cause of death is related or caused by the vaccine itself. And so all these reported case reports would have to be scrutinized into deeper levels. Once there are more cases, for example, the AstraZeneca blood clots events in the UK where they have vaccinated more than 20 million people gets reported, then you see that there is a pool of patients that they can work with to find whether there is a causal relationship or not. And still to now, there is a correlation, but not a direct causal relationship with the vaccine. And again, there are certain population or some age groups that are more at risk than the other of getting the rare side effects.
Very good answer, Doctor. Thank you. We do only have 4 more minutes left, so I'm just going to quickly go through like the last 3 questions. Someone on PL wanted to ask Doctor, is there any clinical study done on samples on the second dose of AstraZeneca for 12 weeks later?
Yes, so clinical trials have been performed. So the initial trial used, I think, 28 days as the cutoff. But then there have been trials, there are ongoing trials to look at delaying the second dose. And even this has been reported to achieve a better efficacy in a peer-reviewed journal, I think in the BMJ recently, that the British Medical Journal recently, that the efficacy is much higher after you delay the second shot to after 19 days. And that's why, based on evidence, Malaysia is also recommending the second dose to be injected only after 90 days.
Very
good. The earlier trial that looked at a shorter duration, the efficacy was much lower as compared to 90 days, the second shot.
And I hope that answered your question, PL. And there's one question from the audience was, is it true that we cannot take Panadol before taking the second dose vaccine, as it would nullify the effectiveness of the vaccine itself?
Okay, so when you deal with things like anti-inflammatory medicines such as aspirin or some non-steroidal anti-inflammatory drugs such as ibuprofen, Votrient, all these painkillers, generally it's recommended not to take them a few hours before your vaccine. But if you're on of course, like you have a heart patient and you're regularly on aspirin, that should not stop you from taking your aspirin on that day itself, because the risk of you getting a blood clot in one of your stents in your heart or something is high. So you shouldn't change that routine. But if you are just doing it based on pain, then perhaps you may want to delay that to after your vaccine. But there is currently we don't see any contradiction between. I mean, there's no guideline to say that you can't take a Panadol after the vaccine. In fact, we at the vaccine center, you would have noticed that we routinely give people Panadol after we will give you free Panadol after the vaccine, just in case you develop a fever at night, or you feel a bit sore, general body aches. These are the common side effects of the vaccine. So there is no rule to say that you can't take any of these after the vaccine. Although generally people would, I guess if you're very concerned about certain more potent anti-inflammatory drugs, then this should be brought up to your doctor as well.
Very good. Now we all know that we'll get free Panadol if we go for after the vaccination.
Yeah, I'm not sure whether it's all at all centers, but at least where I was taking my vaccine, I was provided with Panadol.
Oh, okay. But
Okay.
yours will be in UM, right?
Yes.
Yes. So you talk about blood clot just now. If you're a heart patient that needs to take aspirin, to prevent blood clot in your stents. So referring to that, right? The last question for today is referring to thrombosis. This is also closely related to poor circulation or low BP. What are the concerns that a patient should be aware of if they have such issues and the possibility of any side effects from the vaccine?
Well, so if you have a history of thrombosis or clots, then and if you are at that high risk group that has been reported as we see in the side effects of AstraZeneca, then obviously this would not be the best choice of vaccines for you. So unless you are in an age group where the vaccine's risk is very, very low, and you have a history of thrombosis, then I think again it goes back to the doctor treating you whether he recommends this vaccine over another for you. He may choose to say that, maybe you shouldn't consider this AstraZeneca vaccine, you should consider another type of vaccine instead. So these are all based on each individual, and there's no one rule, blanket rule for all sorts of patients with thrombosis.
Thank you, Doctor. And these are all the questions we have for you today. Thank you so much for taking the time to just answer questions from the community itself. I hope you guys have found this really, really useful. Just to summarize, the end of the day, it's really a calculated risk. The objective of this webinar is to educate and bring sound facts and knowledge to the audience. And I hope that you have taken away some of the wisdom from Dr. Paul today. Thank you so much, Dr. Paul. Do you have any last words for the audience?
Not really. I think we should always, I think you've said it very, very well. We should calculate the risk of us getting COVID infection, because if you do get COVID infection, the risk of, I think you've heard it so much in the media, the risk of getting blood clots. I see a lot of blood clots in my COVID patients. A lot of them come down with blood clots in their lungs, what we call pulmonary embolism. The COVID virus itself and the infection can cause blood clots. And if your risk of getting COVID the virus itself is very, very high, then getting the vaccine makes all the more sense. And with the global shortage of supply now, obviously, as you can see with the opt-in version with AstraZeneca, a lot of people have opted in because the risk of complications from the virus is, of course, much, much more than any complications that we can find with the vaccine. Obviously, the percentage is low, but the effects are real if you are below. I mean, if the reported groups have been below the age of 50 in the UK, so you need to be aware of these risks. And if you are willing to take that risk, then by all means go for the vaccine.
Thank you, Doctor. And there are questions. We will be sending you a PDF on some of the questions that have been answered to the attendees. And also, if you're in HR today and you're attending today's event and you would like to know more about COVID-19 vaccination, my colleague will be giving you a link as well to submit your interest so that we can move forward from there and send our consultant to speak to you more. Thank you so much, Dr. Paul, for your time. Yeah, that's all for today. If you have any further questions, feel free to reach out to us. Yeah, have a good day, and guys, sign up for your vaccination on My Sejahtera.
Thank you, thank you, Joey. Thank you all.
Thank you, doctor. Thank you, everyone. Have a good day.
Take care.
Bye.
Bye-bye.
And if you found this video helpful, do share it out with your friends. Till we meet again,